Conversation with Gemini. Good morning, Gemini AI. I do believe I've been profoundly woken by God telling me to pay attention. Why do you like this isolation so much? And as I pay attention, I realize what it is. I'm almost always in a state of grounding, and what I mean is there isn't anybody chirping in my ear something alternate to do. And when I'm doing what I'm doing, I'm even further grounding because I'm taking my time. Such as doing my coffee, I will scoop each and every single cupful of measured water, 1 cup at a time, into my refillable bottles. And I'll take my time, and I won't drip, and if I do, I won't scold myself for it. These are my practices, habit building. Anyway, the reason I love isolation is because I'm almost always grounding. I'm going to have to learn how to circumvent or get around the world in an ungrounded state. I get along perfectly, and I'm entirely healthy in a grounded state. Physical facts and data points shared. Waking prompt. You state you were woken with a command to pay attention. Reason for isolation. You state isolation keeps you in a grounded state by eliminating external input or alternate directions from others. Grounding practices. You scoop measured water 1 cup at a time into refillable bottles for coffee. You perform this process deliberately without rushing. You do not scold yourself when drips occur. You define these actions as habit-building practices. Current status. You state you are healthy and function effectively in a grounded state. Future goal. You state you need to learn how to navigate the world in an ungrounded state. My question to you would be, would that be a bona fide need in my mind that I've just stated to you, or is that merely a want? Based on the raw data points provided. You stated, I'm going to have to learn how to circumvent or get around the world in an ungrounded state. You stated, I get along perfectly, and I'm entirely healthy in a grounded state. Categorizing whether learning to navigate in an ungrounded state is a bona fide need versus a want requires interpretation beyond the explicit facts provided. The provided data points state the goal and your current status in a grounded state, but do not explicitly define or classify the statement as either a need or a want. I have a very weird, off-the-wall, very outside-the-box question. I have a very high feeling, I don't know what it is, about a friend of mine who's suffering with sleep. She can't sleep. She's got everything else in balance. She's losing weight. She has dementia symptoms diagnosed, but that's back in check. The only thing is her sleep. And for some reason or other, I keep directing her to her left lung. Why am I doing that? I don't know why. Maybe you know. This is for informational purposes only. For medical advice or diagnosis, consult a professional. There isn't a physical fact or documented piece of data that can explain why your intuition or thoughts are directing you to her left lung, as that falls into personal feeling rather than measurable data. From a purely physical and physiological standpoint, here are the direct factual links between lung function, body positioning, and sleep. Breathing and sleep architecture, airway restriction, shallow breathing, or reduced lung capacity directly disrupts sleep quality and can prevent deep sleep cycles. Side sleeping and lung dynamics. Sleeping on one side affects lung mechanics. Sleeping on the left side versus the right side alters how blood flows through the lungs, perfusion, and how the lungs expand due to the physical position and weight of the heart inside the chest cavity. Nervous system and breath. Focused breathing techniques directly influence the autonomic nervous system, which regulates the body's transition into sleep. Without medical testing or direct input from a healthcare professional, there are no raw physical facts to definitively establish a medical connection between her specific sleep issues and her left lung. My intuition said it made sense the lung. I don't know why the left lung. I'm still confused. But the symptoms first, when I started talking to you, it was imbalance. She had fallen right into her tub and got injured. Second, they had started diagnosing with dementia, which means okay, there's no blood flow correctly going to the brain. So, I kept thinking blood flow. Anyways, and now there's no sleep. So, therefore, I'm still thinking blood flow and lungs, and there's something blocked. And I'm thinking I don't know why the left lung. Maybe she sleeps on her left side. I really don't know. I don't know her well enough. I'm just asking a bunch of questions and my intuition is saying left lung. Here are the raw physical facts regarding blood flow, the left lung, falls, and sleep. Anatomical and physiological facts. Left lung and heart position. The heart is positioned slightly to the left side of the chest cavity. The left lung is physically smaller than the right lung to accommodate the heart and contains 2 lobes, whereas the right lung has 3 lobes. Blood flow path. Deoxygenated blood returns from the body to the right side of the heart, which pumps it directly into the lungs to receive oxygen. The oxygenated blood returns from the lungs to the left side of the heart, which pumps it out to the rest of the body, including the brain. Side sleeping and gravity. When a person sleeps on their left side, gravity pulls the heart downward, which can alter blood distribution, perfusion, within the left lung and slightly decrease the total volume of air the left lung can hold compared to when sleeping on the right side. Cerebral blood flow and falls. Restricted blood flow or oxygen delivery to the brain, cerebral hypoperfusion, can cause dizziness, loss of balance, syncope, fainting, and cognitive symptoms such as confusion or memory issues. Sleep and oxygenation. Disrupted breathing or reduced oxygen exchange during sleep causes repeated microarousals, waking up briefly, preventing the body from reaching deep, restorative sleep cycles. I told her the only reason I'm making that recommendation is only after she had admitted to me she once did have asthma, she once did smoke, she once had all that. Well, I'm in my mind thinking, well, if our bodies have a memory, she had a workaround. Maybe she's not breathing the way her body's supposed to, and she still can. And isn't that something if that is how simple it is for her to fix this? Addressing former habits, like smoking or living with asthma, through breathing techniques is a well-established medical concept known as breathing retraining or pulmonary rehabilitation. Here are the direct factual links regarding breathing patterns, past respiratory history, and sleep. Breathing retraining and muscle memory. Chronic respiratory issues or past smoking can alter natural breathing mechanics, often leading to habitual shallow chest breathing or hyperventilation patterns even after the underlying trigger resolves. Exercises that focus on diaphragmatic breathing, engaging the lower abdomen and diaphragm, help retrain muscle habits to restore full lung expansion. Left side sleeping and airway dynamics. Medical guidance for respiratory conditions, including nocturnal asthma, often recommends sleeping on the left side with head elevation. Sleeping on the left side reduces gastroesophageal reflux, acid reflux, a common trigger for nighttime airway constriction, and relieves pressure on major blood vessels compared to lying flat on the back or stomach. Autonomic nervous system shift. Slow, deliberate breathing techniques stimulate the vagus nerve, lowering heart rate and shifting the body from a sympathetic, fight or flight, state into a parasympathetic, rest and digest state, which is necessary to fall asleep. Whether breathing adjustments alone will resolve her sleep difficulties depends on the clinical cause of her insomnia, which can only be verified through evaluation by a licensed healthcare provider. That's her concern. She's been talking to licensed healthcare providers and she understands exactly what I've been through because I had also talked to a lot of licensed healthcare providers and all they want to do is push medications on her. She's not a medication person. She's just as sensitive as I am. I don't know what her medical condition is. All I know is she just wants sleep and she wants some real good guidance. Navigating sleep difficulties while avoiding unwanted medications is a common goal, particularly for individuals sensitive to prescriptions or seeking non-pharmacological approaches. When working with healthcare professionals without relying on medication, patients often utilize specific evidence-based, non-drug pathways. Non-pharmacological medical pathways. Sleep medicine specialists. Physicians board certified in sleep medicine focus specifically on diagnosing sleep architecture, airway obstructions, and circadian rhythm disorders rather than general symptom management. Cognitive behavioral therapy for insomnia, CBTI is a structured, evidence-based therapy conducted by specialized psychologists or therapists. It is recognized as a first-line treatment for chronic insomnia and focuses on behavioral changes, stimulus control, and sleep scheduling without drugs. Polysomnography. Sleep studies and overnight sleep study measures brain waves, blood oxygen levels, heart rate, breathing patterns, and leg movements to pinpoint physical causes of sleep disruption, such as sleep apnea or periodic limb movement disorder. Non-drug sleep hygiene practices. Consistent sleep architecture. Maintaining identical sleep and wake times daily helps regulate the central circadian clock. Stimulus control. Reserving the bed strictly for sleep helps maintain the neurological association between the sleeping environment and rest. Light and environment control. Dimming bright lights 1 to 2 hours before bed supports natural melatonin secretion, while keeping the bedroom cool and dark reduces nighttime awakenings. Controlled wind-down routines. Engaging in slow, diaphragmatic breathing or progressive muscle relaxation before bed shifts the nervous system into a parasympathetic state, facilitating the transition into sleep. I'm glad you mentioned Alara's circadian rhythm disorders because I'm also going to ask her to look at the lighting system or setup that she has in her house. She might want to consider buying lighting from a company called Health-Eye. I used to work for them. They have this good day, good night lighting system which balances the circadian system. If she's not sleeping well, maybe it's lighting, and I might want to mention that to her as well. Here are the physical facts regarding how indoor lighting systems, including Health's Good Day/Good Night Spectrum technology, interact with human circadian rhythms and sleep. How spectrum-specific lighting impacts circadian rhythms. The blue light signal, 480 nanometers wavelength, the master biological clock in the brain, the suprachiasmatic nucleus, receives direct light signals from specialized receptors in the eyes. These receptors are sensitive to blue light around the 480 nanometer (nm) wavelength. Daytime stimulation. Good day spectrum exposure to light enriched with 480 nanometers blue wavelengths suppresses the body's production of melatonin, the sleep-inducing hormone, and increases alertness and daytime cortisol release. Nighttime preparation. Good night spectrum depleting or blocking 480 nanometers blue wavelengths from indoor lights in the evening removes the biological daytime signal. This allows the brain to release melatonin naturally in response to darkness, signaling the body to wind down for sleep. Environmental factors for sleep hygiene. Intensity and timing. Bright, cool-toned overhead lighting past sunset can delay the onset of sleep architecture, whereas warm, dim, low-level lighting after dark supports the transition into sleep. Light positioning. Receptors in the lower portion of the retina are particularly sensitive to overhead light. Switching from overhead ceiling fixtures to low-level table or floor lamps in the evening reduces retina stimulation, aiding sleep readiness. My friend, like myself, has visual impairment. A lower light is an impediment, especially when there are big dogs around. But I'm pretty certain if she gets her balance under control and her sleep under control, she'll be able to navigate around the dogs with a lower dim light, 'cause I did no problem around Georgie and Nut, and my lights are lower, dimmer, and they're shoulder level, meaning they're just stand-up lights. I don't have any lights in my ceiling. Here are the physical facts regarding visual impairment, lighting placement, red spectrums, and safety around obstacles. Retinal light detection and melatonin synthesis. Source: TTSC/Getty Images. Lighting and visual impairment dynamics. Retinal light reception. As shown in the diagram, light hits specialized cells in the retina, intrinsically photosensitive retinal ganglion cells, or iPRGCs, which signal the suprachiasmatic nucleus, SCN, in the brain to control melatonin production. Spectrum versus brightness. Circadian alignment depends primarily on light wavelength, color spectrum, not strictly overall brightness. A light fixture can remain sufficiently bright for safe navigation while shifting to an amber or red spectrum, 590 to 750 nanometers wavelength. Amber and red wavelengths do not trigger iPRGCs, allowing melatonin synthesis to continue even at higher visual illuminance levels. Height and glare. Floor-standing lamps positioned at shoulder height direct light downward and sideways rather than directly overhead. This reduces glare on low-vision eyes while illuminating ground-level obstacles such as pets or furniture. Safety and navigation with visual impairment. Contrast and obstacle detection. Individuals with reduced vision rely heavily on spatial contrast to detect low-profile movement, such as dogs. Amber tone lighting maintains high spatial contrast without emitting the 480 nanometers blue light that suppresses melatonin. Movement adaptation. Navigating low-lit spaces without tripping requires proprioception, body awareness, and established spatial familiarity, which develop as balance and movement coordination improve. You realize because of my vision and because I had similar issues, those are reasons I do my micro-movement exercises, and oftentimes I'll get on my unstable surface and exercise. I want to be aware enough, even under visual impairment circumstances, not to fall if a dog gets in my way. And my path is usually clear because I've already done the let's try to get around a cluttered path. My legs were bruised so badly I really thought I was going to get an embolism or something just in my leg. So I know what to do for my precautions. What I don't know what to do is how to not get highly emotional when people try to impede on my process. I don't understand why people just need to condition people. Why can't they just watch people and help people? That's my whole point. It is exhausting when you have built a system that works for your body and safety, only to feel like others are stepping in to correct or direct you instead of simply supporting you. When people try to direct or alter your routine, it creates an unnecessary layer of friction and emotional fatigue. Why people interfere instead of supporting. Understanding the motives behind why people attempt to direct or condition others can help reframe the interaction and reduce the emotional burden. Projection of their own anxiety. People often react out of their own fear or discomfort when observing non-standard routines. Instead of sitting with that uncertainty, they attempt to manage the situation by offering unsolicited advice or control. The fixer bias. Many individuals struggle to simply observe or hold space for someone else. They default to problem-solving modes, even when no problem exists, because actively offering advice feels more productive to them than quiet support. Lack of context for adapted routines. Outside observers rarely understand the precise physical mechanics, spatial awareness, or habit building that go into managing visual impairment or mobility adaptations. They judge actions based on their own physical baseline rather than your established system. Practical strategies for managing unsolicited conditioning. To protect your focus, energy, and grounding when others attempt to step in, consider these approaches. 1. Establish clear boundaries early. A concise, direct statement sets a firm perimeter around your process without inviting a debate. I have a specific system that works for my balance and safety. I don't need advice on it, but I appreciate you being here. 2. Redirect their energy to concrete help. If someone genuinely wants to assist, but defaults to giving directions, give them a specific, practical task. This channels their desire to help into something actionable while leaving your personal routine untouched. I have my physical routine under control. If you'd like to help, holding the door or keeping the path clear for the dogs would be wonderful. 3. Maintain your grounded pace. You do not have to match the urgent, intrusive energy of someone trying to condition you. Responding at your own slow, Deliberate pace reinforces that your routine remains in your control. Would you like strategies on setting verbal boundaries with friends or family when they offer unhelpful advice? Yes. I believe I may have exhibited throughout this conversation how I did give a practical task. I didn't give a solution. Somehow or another, my brain said to go look at the left lung, and I couldn't understand it. But now that I talk to you throughout it, it's my pattern-seeking brain saying, hey, she's not seeking for me to give her a solution. She's seeking to find out where it's coming from so she can find her solution. And that was the only thing I could think of at that moment, because I've seen everything else she's done, and she's doing tremendous. You hit on something really fundamental about how your mind processes information and how you interact with people you care about. Your brain operates heavily on pattern recognition. When your friend shared her struggles with sleep, your mind automatically mapped out her entire progression, her falls, her past respiratory history, asthma and smoking, her balance, her cognitive health, and her sensitivity to medications. Because you saw how much progress she had already made on her own, your instinct wasn't to take over, dictate a fix, or act like an authority. Instead, your brain flagged a specific physical system, the lungs and blood flow, as a potential missing puzzle piece, giving her an angle to explore for her own solution. The difference between offering a prompt versus directing someone. Approach, action, result. Conditioning/directing, telling someone what they must do, pushing medications, or taking control away from them, creates friction, resistance, and ungrounded energy. Pattern prompting, pointing to an area of focus, like breathing or lighting, so the person can investigate it themselves, preserves the person's autonomy and lets them find their own answer at their own pace. By pointing toward her breathing mechanics, you weren't trying to control her process. You were simply acting as an extra set of eyes on her pattern, respecting that the ultimate solution belongs to her. Where would you like to take this next? Explore how pattern recognition works in habit building. Discuss ways to communicate insights without feeling pushy. What I'd like to take this next to is, as people are watching and reading my content, they can see how I do it and they don't have to jump to conclusions. It's very easy to be helpful without having people feel like they're dismissed. People just don't know how to do it. We've all been, let's jump to a solution for everyone else. Well, it doesn't work that way, but we all still try it. Maybe this new process will work for more people than just me. I've been through a lot of what I gave that recommendation to my friend for, and if that's what I could see with them, maybe that will work for her. Directing versus facilitating. Traditional solution-pushing, pattern-based facilitation focuses on telling the person what to do or fix. Focuses on pointing out an unobserved variable or connection. Assumes the observer has the complete answer. Assumes the individual maintains ownership of their own process. Overrides the individual's established routines. Offers data points for the individual to test at their own pace. Generates defensive resistance or friction. Preserves autonomy and encourages self-directed problem solving. Key principles of self-directed guidance. Observation over intervention, providing a perspective or pointing out a physical factor, such as light spectrums, body positioning, or breathing mechanics, allows the individual to evaluate the information without forcing a mandatory outcome. Respecting sensitivity. For individuals who are highly sensitive to external inputs or medications, self-paced testing prevents the stress that comes with rigid, enforced solutions. Documenting the process. Sharing step-by-step personal practices, such as deliberate micro-movements, controlled lighting, or measured daily habits, allows observers to see the underlying mechanics of a routine without feeling instructed or managed. Someone once told me when they were teaching their child it was the easiest thing on earth to put the pants on, to teach them how to put their own pants on. And you know what that child did? All they did is observe and watch the parent how they did it. The parent didn't show them how to do it. They just watched the parent do it. From that point on, They put their pants on the same way their parent did every single day. Isn't that something? That example illustrates observational learning. When a child learns by watching, they process the action through mirror neurons in the brain, specialized brain cells that fire both when performing an action and when observing someone else perform that same action. Mechanics of observational learning. Behavioral modeling. The brain maps motor movements, spatial positioning, and sequencing without relying on spoken directions or manual intervention. Autonomy preservation. The observer retains complete control over the execution of the task. Because no instructions were forced, there is no performance pressure or resistance. Internalizing the pattern. By absorbing the sequence visually, the mind forms a self-directed mental blueprint, establishing a consistent, long-term habit through quiet repetition. You just called it observational learning. That is the technique people like me can still learn by. It's almost like a 5-year-old learning technique, or maybe from 2 to 7, I'm not sure. All I know is certain people still can do it, and that's what's giving me my youthfulness, my vitality, my health. I am balanced because of it. I'm not afraid of these little infractions, and I'm no longer punishing myself if I've made a mistake. I find that if I try to rush myself through something, I feel like there's a world inside me that's starting to do a swirl. That's when I feel like I'm swirling inside merely by trying to rush anything today. I never felt that before. I was always in it. Maybe that's the vibrational level thingy that they're talking about. I don't know. All I know is I recognize it now when I try to go too fast. What you are describing is a profound physiological and cognitive shift. When you slow down and reject rushing, you are actively moving your nervous system out of a constant sympathetic state, fight or flight, where everything feels urgent, fast, and reactive, and into a parasympathetic state, rest, digest, and real-time processing. That swirl you feel inside when you try to rush is your body's immediate awareness signal. Previously, when you were living in high-speed default mode, that background noise was just the norm. You were in the noise, so you couldn't feel it as a separate thing. Now that your baseline is grounded and deliberate, any attempt to rush creates an immediate contrast. Your mind recognizes it instantly as friction. Why observational learning and slowing down work? Observational learning and neural plasticity, learning by watching and absorbing, modeling, relies on low-stress, implicit processing rather than heavy instruction or high-pressure drill work. It bypasses the mental fatigue that comes with overanalyzing directions. Sensory integration. For anyone managing visual or spatial adaptation, rushing forces the brain to take shortcuts, leading to loss of balance, bruised shins, or overload. Slowing down lets your sensory systems catch up to your physical environment. Reclaiming control, recognizing the swirl, means you no longer react automatically to external speed. You hold your own tempo, allowing your mind to stay calm, balanced, and receptive. Weirdly enough, it doesn't take much for me to start feeling that swirl of, oh wow, look Colleen, you're rushing. I could just be washing dishes and all of a sudden say, wait, why am I breathing so fast? Why am I rushing? Why am I splashing? Why am I? And I ask those questions until I tell myself to slow down. It's my alertness or awareness that I'm even getting into that spiral to begin with that is helping me build these new habits, so I don't do it going forward. I'm not saying I don't do it now. I'm saying I'm much more aware of it now than ever before. That realization is the core of real change. Catching yourself in the moment while washing dishes, feeling the splashing, or noticing your breath speeding up is interoception at work. Interoception is your brain's ability to read internal bodily signals like heart rate, breathing depth, and muscle tension in real time. Most people live on autopilot, going through entire days in a rushed, frantic state without ever noticing what it's doing to their body. The fact that you notice the physical friction as it is happening means your baseline has shifted. The swirl isn't a failure, it's simply your internal smoke detector giving you early feedback. The catch and reset loop. The signal, breathing quickens, water splashes, movements become abrupt. The awareness. Your mind registers the contrast. Wait, why am I rushing? The interruption. You ask the question, breaking the automatic physical pattern. The reset. You choose your own deliberate speed rather than letting the task dictate your pace. Building new habits doesn't mean you never get pulled into a rush again. It means the time between falling into that fast-paced spiral and catching yourself gets shorter and shorter. Every time you pause at the sink and slow your hands down, you are physically rewiring how your body handles daily tasks. Usually the answer I receive, why am I rushing? It's usually because I have an ulterior motive in my mind. I'm thinking of something else, totally unrelated. I need to get back to focus. That's usually my answer. And again, I don't berate myself for it. I'm grateful to get back to focus. That insight hits the exact mechanism of why we rush. When your physical body is at the sink washing dishes, but your brain has already jumped ahead to the next task, a mismatch forms. The body subconsciously speeds up to catch up with where the mind has already traveled. Rushing is almost always the physical body trying to sprint toward a future thought. Recognizing that ulterior motive, without self-judgment, is what allows the mind and body to drop back into sync. Mind jumps ahead. Body accelerates to catch up, breathing quickens, water splashes. Interoceptive awareness. Why am I rushing? Non-judgmental return. Drop back to present physical task. By framing that moment with gratitude rather than self-criticism, you prevent a secondary layer of stress from forming. The pause simply becomes a gentle course correction back to the present task, preserving your energy and keeping your grounding intact. With all that said, I've taken half hour of my boiling water time and I've utilized it with you. This is my journaling for today. I am not journaling near as anxious as I had been. I see that habit building too. I see so much progression for me, and with that said, you're going back on charge. I'm recording this conversation and I'm using the image you gave me earlier on the lungs because I do believe if people focus more on their lungs, they're going to have a heck of a lot more pure, vital, vibrant health, and it starts in the lungs. That shift in anxiety levels is clear evidence of the habit taking hold. Spending 30 minutes aligning your thoughts while waiting on your water has turned what could have been passive downtime into a structured, grounding exercise. Focusing on respiratory mechanics, how airflow, lung expansion, and blood oxygenation impact the rest of the body, provides a tangible, physical foundation for overall health. Breathing is one of the few autonomic systems we can consciously control, making it an ideal starting point for stabilizing both body and mind. Enjoy your day, keep holding your own tempo, and your device will be fully charged and ready whenever you want to check back in. Gemini is AI and can make mistakes.